Today, a House committee heard testimony on the effects of the Supreme Court reversing Roe v. Wade. This ahead of an expected House vote on contraceptive rights tomorrow. In Roe's wake, physicians are consulting legal teams to decide whether certain reproductive care is legal in their state. Joining us right now is Dr. Tani Malhotra, a maternal fetal medicine specialist in Cleveland, Ohio. Doctor, thanks for being with us. You are a high-risk pregnancy physician in Ohio, a state that just outlawed abortion after 6 weeks. What impact have you experienced on your ability to provide care?
The impacts, thank you for having me, first of all. The impacts sort of are far-reaching. You know, the law makes no exceptions for rape and incest. It makes no exceptions for lethal fetal anomalies, and makes an exception that's very vague for threat to maternal life. So we have patients who are young, who we can't even offer, even if their pregnancy is as a result of sexual assault or abuse, we can't offer abortions for them. We cannot. We can tell patients that their fetus has a lethal anomaly, one that is not compatible with life after birth. And we give them this horrible, heartbreaking news and then tell them, sorry, legally, there's nothing I can do. Medically, there is, but legally, there isn't. And finally, then there's the case of threat to maternal life. The way that the laws are written, they're so vague. They've sort of left us in a tailspin where we can't figure out how to manage our patients and counsel our patients. And we have to call a lawyer before we can make medically sound decisions that 4 weeks ago we were making on our own without any issues.
And what does that mean for you having to call your lawyer if you have a patient in an examination room or a patient who is in desperate need of care where every minute matters?
Yeah, the worst part of it is in that latter situation where you have a patient who is having a medical emergency, where medically I know what the decision to make is, and we've had to step out of the room and say, call the lawyers and make sure that what we were doing was okay to do. We're experts in medicine, not in law, and we need now to be able to consult our lawyers. I'm lucky to be at a place where I can consult lawyers, but I can't say that everyone will be as lucky as me.
The Washington Post reports of delayed and denied abortion care in really stark terms, life-threatening situations. In one situation, an ectopic pregnancy, instead of prescribing medication to terminate the pregnancy in the safest manner, as she would have done before last month's ruling, the doctor was forced to perform a riskier, invasive surgical procedure to confirm the location of the ectopic pregnancy before ending it. We know that these types of pregnancies are never viable. They are life-threatening. So what are the consequences here if doctors can't act as fast as they normally would have to provide the needed care?
Yeah, the consequences are life-threatening, and unfortunately, we do have a carve-out for ectopic pregnancies in Ohio, but again, you know, the laws are written vaguely, and even aside from ectopic pregnancies, there are so many other life-threatening conditions in which we may recommend or perform an abortion that we now cannot do. And inherently, pregnancy is risky. 19 of every 100,000 pregnancies will result in maternal deaths. 19, that's a big number, and that's higher in some other states. So inherently it's risky. So are we allowed to offer them an abortion? We don't know. What about 50%? Can we offer it then? Or do they have to be actively dying before we're able to say, hey, we're going to be able to provide this life-saving care for you?
What do you need, doctor, on a state or federal level?
We need the politicians to stay out of our exam rooms. That's the bottom line. These are politicians with very limited or no knowledge about medical care. We need them to work on improving access for patients, improving infrastructure and support for patients to be able to receive the medical care they need, not interfering in my ability to make medically sound, evidence-based decisions.